I'm Dr. Colin Swenson, a pulmonologist and director of the Bronchiectasis and Non-Tuberculous Mycobacterial Program. Bronchiectasis is a chronic lung condition that's characterized by abnormal widening or dilation of the airways. What happens in bronchiectasis is those secretions tend to stick and pool in those bronchiectatic or enlarged airways. Airway clearance techniques are really the mainstay of treatment for bronchiectasis. And the reason it's important, as you can see over here, is that you have the normal airway. You can see that it's nice and round structure, and you can see that there's this nice layer of mucus that well hydrates the lining of the airway. What happens in bronchiectasis, as the airway starts to abnormally widen, it also becomes extremely floppy. And when it gets floppy, it tends to trap mucus in place. And so airway clearance really enables that mucus to not stagnate, to become more mobile, so that patients can then expectorate it or cough it out.
Good morning, Erin. How are you?
I'm good. How are you?
I'm well, thanks. I'm Ramon with Respiratory, and today we'll be going over airway clearance therapy as well as some medication administration with the Albuterol, okay?
Okay.
All right. Did your doctor go over what Albuterol does and how it's going to work for you?
Yes, they did.
Oh, great. All right, so today we're going to show you how to use your Albuterol along with the spacer, okay? The Albuterol is going to relax your airways so it's easier for you to breathe. And the spacer is going to hold the Albuterol so it's easier for you to take a nice slow breath in to get more medication deeper inside of your lungs, okay?
Okay.
All right, so what I'm going to have you do is take the mouthpiece off. This is where you'll be taking your breath in. Before you take that breath in, you're going to spray one pump inside of the spacer. You're going to take a breath in, get that medication down, move the spacer away from your mouth, and then repeat the process. Okay?
Okay.
All right, let's try it out. Perfect. One more time. Great job. All right, I can take that from you. All right, so the next form of therapy is your airway clearance therapy. So this is a form of OPEP, oscillating positive expiratory pressure. What this is going to do is help mobilize your secretions using that positive pressure and the oscillation. So what you're going to do is take a breath in. When you exhale, you're going to feel the machine vibrate, and you're going to also feel the vibration inside of your chest. That's how you know it's working. On the front of the device, you'll see there's numbers 1 through 5. That's going to be the resistance that you feel when you do that full exhalation. Okay, let's try it out. What I'm going to have you do is 10 breaths. After the first 10, you'll stop and do a huff cough, and then you'll do your final 10 breaths, and then you can do another set of huff coughs after that. All right, you've done your 10 breaths. So we're going to pause, and I'm going to show you how you do a huff cough, okay? What we're trying to get you to do is generate a cough. In order for you to do that, I'm going to have you do 2 quick bursts of exhalation, and then you'll do a prolonged exhalation at the end. So normally after that prolonged exhalation, you're able to cough. If you're unable to cough, go ahead and try it again. And if you're not, that means your secretions haven't moved up high enough into your bigger airways to expel them. So you can just go ahead and do the last 10 on your OPEP, okay?
Okay.
So let's try your huff cough.
Okay.
Good. One more time. All right, great job. And now you can do your last.
Okay.
Mm-hmm. All right, great job. Thank you. Now, I also saw that your doctor wrote for you to have sodium chloride. This medication is going to hydrate your lungs to help thin out the secretion so it's easier for you to expel them or cough them up, okay? You're going to use that in conjunction with your nebulizer. What you're going to do is remove your mouthpiece first. You can then connect your nebulizer to your airway chamber. That way, when you're taking you're inhaling and getting that medication into your lungs, when you exhale, you're getting that PEP therapy as well, okay? All right, so in order for you to get the medication inside of your nebulizer cup, you're going to open the top, open your sodium chloride, squeeze it inside of it, put the top back on, close it back up, connect it to your PEP therapy. Before getting started, you want to connect one end of your tubing to your cup. You'll connect the opposite end of your tubing to your compressor. I hand this to you.
Okay.
And then I'm going to turn your compressor on so you can start getting the medication, okay?
Okay.
So on. Now I'm going to just have you take normal breaths in and out over the course of 10 minutes, okay? If you get to a point where it's too much, you can stop and take a break. At the end of the 10 minutes, we'll do a huff cough, and then we'll be done, okay?
Okay.
Let's try it out. All right, thank you. Great job today.